Administering oxygen by cannula and face mask. Verify written order for oxygen therapy, including methods of delivery and flow rate. This is to avoid medical error. Introduce self and verify the client's identity. This is to make sure procedure is done to the right client. Explain to the client the purpose of procedure. This is to reduce patient's anxiety. Perform hand hygiene and put on PPE if indicated. This is to prevent spread of microorganisms. Provide client privacy if appropriate. This is to promote comfort. Setting up the oxygen equipment and the humidifier. Attach the flow meter to the wall outlet or tank. The flow meter should be in the off position. Flow meter shows level of O2 delivered. Fill the humidifier bottle with water. Attach the humidifier bottle to the base of the flow meter. This is to make O2 being breathed humidified. Attach the prescribed oxygen tubing and delivery device to the humidifier. This is to allow oxygenation of the patient following the prescribed equipment. Turn on oxygen flow at the prescribed rate by turning the thumb screw or knob. This is to administer supplemental oxygen to the client. Check the tubing for kinks. Feel for the flow of air at the outlets of the cannula, mask, or tent. This is to check if oxygen is flowing smoothly. Check for presence of bubbles in the humidifier as the oxygen flows through. This is to check if oxygen is humidified. Apply the appropriate oxygen delivery device. This is to administer supplemental oxygen to the client. Using cannula. Put the cannula over the client's face with the outlet prongs fitting into the nares and the tubing hooked around the ears. Adjust the fit of the tubing by sliding the adjuster upward to hold the cannula in place. Gently position nasal prongs into client's nares with curves of prongs pointing toward the floor of the nostrils. This is to apply nasal cannula and secure its position. If the cannula will not stay in place, tape it at the sides of the face. This is for the cannula to stay in place. Assess the nares, face, and ears every 4 hours for signs of skin irritation and breakdown. This is to maintain skin integrity. Inspect nasal prongs for presence of nasal secretions or crust. Wipe the prongs with gauze pad as needed. This is to promote comfort and maintain hygiene. Using face mask. Guide the mask toward the client's face and apply it from the nose downward. This is to place the mask comfortably without irritating the client. Fit the mask to the contours of the client's face. Adjust the elastic strap around the client's head so that the mask fits snugly but comfortably on the face. The mask should mold to the face so that very little oxygen escapes into the eyes or around the cheeks and chin. Inspect the facial skin frequently for dampness and dry and treat it as needed. This is to inspect for any abnormalities that needs immediate attention. Assess the client's vital signs, level of anxiety, color, and ease of respirations. This is to check client's response from the oxygenation. Assess the client in 15 to 30 minutes depending on the client's condition and regularly thereafter for clinical signs of hypoxia, tachycardia, confusion, dyspnea, restlessness, and cyanosis. Review oxygen saturation and arterial blood gas results if available. This is to ensure doing the right procedure and to find any deviations. Inspect the equipment on a regular basis. Check liter flow and level of water in the humidifier. This is to inspect condition for accurate provision. Lastly, document findings in the client record. This is for legal purposes and record of data.